The following segment is sponsored by Ward MD and Form Derm Spa. I am here chatting with Dr. Iorio and Dr. Powers with Ward MD, and we're talking all things Botox right now. Thank you for joining me. Great to see you both.
Yes,
Thank you.
Good to see you.
Good to see you too. Okay, let's start with, if people aren't familiar, what is Botox?
So Botox, Dysport, Xeomin, those are all trade names for botulinum toxin. So it's actually derived from a bacteria. It's what we call a neuromodulator or neurotoxin. It actually prevents release of a certain neurotransmitter from muscle cells, so you can't contract muscles. And it's temporary. It only lasts about 3 to 4 months depending on your body's metabolism, and then you get full muscle function back.
Okay, so it just kind of relaxes the muscles in the areas that you want it. Where do we typically get it done? What areas of the face?
I would say the most common place that people get it is forehead, around the glabella, or where people furrow or scowl, and then around the crow's feet area. That's like the most common spots that you'll see people get it. But you can kind of get it other places throughout the face as well.
Okay, depending on what you want.
Exactly.
Your results. Now, I know people at home are going, okay, I know it is needles, this is involved. Does it hurt?
No. Speaking from experience, to me it doesn't hurt at all. We also do all kinds of things to try to help trick you into not really paying attention. So we use a little vibration wand that we'll put on other nerves around the area to distract you. It's a distractor to keep your nerves excited somewhere else so that you don't feel the injections. We also have stress balls and things like that. But it really isn't painful at all. It's super fast.
Super fast. And when will we see results once we get it done?
Typically you'll start to see some changes within 5 to 7 days, but you see your most benefit at 2 weeks. That's when it's at its peak effect.
In 2 weeks. Okay. Now, there are a lot of common myths that we see with Botox, Dr. Powers. The first one may be that we're going to be this, overly plastic look and we're going to look insane. Is this true?
No. And I think it really depends on your injector, right? It really depends on the hand of who is putting the product in. And we're very specific in terms of targeting the muscle that we want to treat, but not over treating. And so that means we like to still maintain some brow elevation, be able to still animate the face and look very natural, but as well as treat all of those wrinkles.
Sure. Yeah. Okay, and next myth would be, is it dangerous?
No, it's very specific in terms of where it stays. So that product is local, it doesn't go systemically, and it really gets bound to the muscle, they think within 20 minutes of the initial injection. And so oftentimes people are worried, okay, is this gonna go systemic? This is an injection, but no, it really binds to that muscle that it's put into.
It binds to the muscle. Okay, now I know you said Botox, Dysport, there are other options. What's the differences between those? Is it just kind of what works best for you?
They're all made by different companies. They all work very similarly. There's been tons of trials trying to prove which one's better, and none of them have been great. So it really just depends on what company you go with and which product you like.
Okay, now if someone wants to come in and say, I don't know what I need, I don't know what I'm just feeling a little tired, and maybe it's Botox, can we do a consultation first? Is that what we should do?
Of course.
Yes, definitely.
Okay, and we'll call and make sure, and we do that beforehand, because maybe we're a little nervous to get the Botox done, get the consultation. If we want to make our appointment right now, where can we go?
You can go onto wardmd.com.
Perfect.
Schedule a consultation.
Thanks so much for the information. Great to see you.
Thanks.